Good morning. I'm Michael Jones, and welcome to our Cracking the Code webinar. And today we're going to talk about CPT and ICD 10 codes. Now, I know a lot of you out there are medical exercise professionals, and you're looking to build your practices, but you're also looking to connect with the medical community. And one of the questions they always ask is if you take insurance. Now, I'm going to be honest with you. Back in 1996, a couple of years after we started the medical exercise specialists, was quoted saying, I didn't think we'd ever see insurance reimbursement for medical exercise professionals. Well, folks, I'm going to take my foot out of my mouth because we actually are starting to see it more and more, particularly over the last decade. So with that, what I wanted to do this morning was talk about the idea of ICD 10 codes, which are the diagnostic codes, and CPT codes, which are the current procedural terminology codes that allow you to deal with insurance carriers. Now, let me make sure you understand, just knowing a CPT code is not the answer. Let me repeat that. Just simply knowing a CPT code is not the answer. I'm going to say it again. Just knowing a CPT code is not the answer. There is a process, a systematic process you must go through to submit an insurance claim for reimbursement for medical exercise training services. So we're going to talk about these CPT codes and ICD 10 codes, but also I'm going to bring you up to speed on a couple other things that you need to be aware of before you start trying to build an insurance carrier. It's not just simply CPT codes, ICD 10 codes, it's the process in the system. So if you don't mind, I'm going to share my screen with you here real quick. And we've got a presentation we're going to talk about this morning. All righty. And let me go to the slideshow here. And let's go ahead to the beginning of our slideshow. All righty. Okay, again, I'm Michael Jones, president of the Medical Exercise Training Institute. And 31 years ago, we did the first medical exercise specialist workshop and certification in Washington, D.C. I'm a physical therapist. I'm a Howard University graduate of 1985. We found in our private physical therapy clinics that as we were discharging our patients, we had to discharge them earlier in the 1990s because of insurance cutbacks. But with that, we wanted to find an effective means of transitioning them out of the clinics into a safe and effective exercise program. That's when we started dealing with personal trainers. We had a couple of nightmare scenarios. And with those nightmare scenarios with trainers, we realized we needed to provide the training and the education to help medical exercise professionals make that transition. With that, we started the Medical Exercise Specialist Workshop and Training Series. So with that, that's where we are now. And we've been moving along with that for decades now, actually 3 decades and 1 year. So this is our 31st year. So with that said, we now are realizing that one of the key points for you is to start dealing with insurance carriers. We're seeing more and more of our MESs do that. We have a couple that have actually become providers with insurance networks or in insurance networks, and we're seeing hundreds that are actually able to receive reimbursement from insurance carriers. So what we're going to do here for 30 minutes is talk about the CPT and ICD 10 codes and what every MedX Pro or medical exercise professional absolutely needs to know. We're going to try to get this done in 30 minutes. So let me keep going here. All righty. So with that, folks, all of this information we're going to go over, you can obtain in our Cracking the Code or digital manual. This is a manual we put together, I guess about a month or so ago. We just released it last week, and it is a manual. It is a PDF document that you can download. It is a digital manual. It's not a printable manual, and it has 398 pages of guidelines, procedures for billing, the step-by-step process, billing systems, CPT codes, ICD 10 codes, sample forms that you'll need if you want to build an insurance carrier. And folks, we put everything in here that a medical exercise professional needs. Actually, I have a digital copy myself. Actually, I use it on my iPad, and we're doing the digital copies initially because we know we're going to have some updates. We don't want to have you buy a hard copy, and then we got to update it and send you something. So probably in about 3 or 4 weeks, we'll have a hard copy that will ship to you. But right now, we have the digital copies available. They are $129. And if you go over to crackingthecode.com, you should see them there. Or at the end of this presentation, you'll see a link where you can actually download or purchase the manual. So with that, let me keep going. Again, we're going to talk about CPT codes as well as ICD 10 codes that are used for medical exercise training. A couple key points we need to go over first. Your scope of practice. Now, folks, we've taught this for 31 years. It is at the beginning of all of our presentations, all of our workshops, all of our courses. What is your scope of practice as a medical exercise specialist and your role? Now, I want to make sure we cover this because you can't bill for things that are outside of your scope of practice. So number one, you are authorized, or I shouldn't say authorized, but it's within your scope of practice to perform a medical exercise training or MET assessment. Within your scope of practice, you can provide cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, which becomes vitally important as we're moving forward, dealing with so many seniors and the crush of new individuals entering the healthcare system, aquatic training and stabilization training. Notice it doesn't say anything about myofascial release techniques, which technically could be flexibility. It doesn't say anything about cupping procedures. It doesn't say anything about massage or even using a Theragun, which is technically massage. It stays within your scope of practice or outlines your scope of practice here. So before we even start talking about billing, you cannot bill for procedures that are provided by a licensed medical professional, such as a physical therapist or a chiropractor or an occupational therapist, nurse, or physician. You can only bill for things that are within your scope of practice. And as a non-licensed provider, you got to be very conscious of that. So please, if you would, make sure you understand that you are not a licensed provider, but as a medical exercise professional, as long as you stay within your scope of practice, which is essentially managing medical conditions utilizing exercise after physical therapy, chiropractic services are done, as well as making sure you get a referral from the client's physician, therapist, or chiropractor, you're good. You can bill for your services. And please, if you would, make sure you're upfront telling the client about your role and your scope of practice and your credentials, as well as sharing that with the doctor, therapist, or chiropractor that the client may have been referred from. And if you have to, make sure you share that with the insurance carrier. Now, next on our list here, the reimbursement criteria. Now, folks, this is important. A client comes to you and says, hey, can I use my insurance just to work out with you? Okay, they have a medical condition, but it's not a medical condition that they're having a problem with. So this isn't just simply the client has a medical condition, I'm going to bill their insurance. No. It's not like that. This isn't a health savings account. This is actually now you're submitting to the insurance carrier to get reimbursed for the services you provide. So a couple criteria here. Number one, you have to have a written referral from an MD, a DO, a doctor of podiatry, DPM, a nurse practitioner, NP, or a physician's assistant. Now, the nurse practitioner and the physician's assistant are normally working on the auspices of an MD, a DO, or maybe even a podiatrist. But you must get a written referral from that medical provider, and it must say medical exercise training, functional conditioning, post-rehab training. It should not say, personal training, nor should it address any aspects of therapy. So it can't say physical therapy. It can't say exercise therapy. Please remember this. As a medical exercise professional, you don't have patients, you have clients. You don't provide therapy, you're providing exercise. And this idea of I'm treating the patient, no. You're an exercise professional. You're not doing a medical treatment. You're a medical exercise professional. You're simply providing exercise. Now, a couple other criteria. The client has received maximum benefit from PT, OT, or chiropractic. That means they didn't circumvent getting the appropriate professional therapy services and come to you. They saw the therapist, they got the maximum benefit from that, and then they came to see you. This client usually has a chronic condition, or they underwent surgery, or they have residual functional deficits that are left over from their surgery, their injury, or the onset of their condition. So this isn't the guy who pulled his hamstring playing softball last Thursday and now comes to you and says, since you're my trainer, I'm going to use my insurance so you can help me with this. No, the system is not designed to circumvent medical care or appropriate medical care. You're providing medical exercise training, which means this is exercise after the client has received the appropriate medical care. And the last thing here, the insurance coverage is not via Medicaid or Medicare. Okay, Medicare and Medicaid are not going to pay you. Their guidelines require that you be a licensed medical provider. So that's not going to work. So with that, let's move on. CPT codes. Now, this is what everybody wants to know, the CPT codes. What codes do I use to bill the insurance carrier? So we've got a list here, 97110, therapeutic exercise. This means exercise that looks at strength, flexibility, endurance. This is just basic exercise, basic strength training, basic flexibility training, basic endurance training, whatever the case is. This is basic exercise. It's designed to just simply increase strength, increase flexibility, increase balance, whatever the case. It's just simple, basic exercise. The next code here, 97112, is when you're working on balance, or you're working on coordination, or you're working on anything that involves the neurologic system. This is neuromuscular reeducation. So 97112 is when you're doing higher level exercise that's working more on balance, posture, standing, gait, things of that nature. Next one, 97116, you can work with clients on gait, but I'm going to tell you, this code 97116 is very seldom used. 97110, often used. 97112, often used. And our next one, 97530, therapeutic activities. This is when now you're utilizing activities, but these activities or exercises that you're using are more geared toward the client's functional capabilities. Maybe you're doing activities where they can learn how to reach overhead, or they can learn how to bend or sit or get out of a chair or do something that is functional. So let's make sure we're clear. The 97110 code, therapeutic exercise, is just for that, the exercise component, just straight exercise. 97112, neuromuscular reeducation, balance, posture, coordination, things of that nature. The 97116, gait training, but actually 97112 covers most of that. So you may use 97116 occasionally, but I'm going to advise not to use that one. But when you're working on activities that are functional, such as gait, reaching, lifting, pushing, pulling, carrying, activities of daily living, use 97530, therapeutic activities. Now, we have a couple other codes here, 97530, self-care, home management, when you're helping a client set up their home or helping them with navigating their home. You're doing more lifestyle management. You could also use 97750 to look at the client's physical performance testing, as in maybe use a functional assessment scale like the Tinetti Gait and Balance Scale or the Listholm scale for the knee. And you have the client perform the activities, you grade those activities, and now you have a measurement tool. You can actually bill for that through 97750. But you're going to find that probably your best means of evaluating the client and charging for that or billing for it will be 97116, which is a low complexity assessment or evaluation. Now, please remember, all of these codes are in 15-minute increments, and they drill down even deeper when they're looking at the billing process, and we cover that in the Cracking the Code manual. So the standard concept is a 15-minute billable unit, but insurance carriers are starting to look at that even more closely, and now they're looking at 8-minute increments, 16 and up to 22-minute increments, and we go over those in great detail in our Cracking the Code manual. So what I wanted to do today was just introduce you to these codes. Again, the ones you'll most often use, 97110, 97112, and 97530. For the assessment, 97161. Again, these are 15-minute increments. If you're working with the client for, say, 45 minutes, then you're going to use 3 of these codes. And I would recommend also that you don't use the same code 3 times, because theoretically, you're not doing the same type of exercise for 45 minutes with a client. Change up the codes. Make sure that the codes truly depict the services or exercises you're having the client perform during the session. So CPT codes. ICD-10 codes. Now, these are important too, folks, because the client has to have a diagnosis. And folks, every diagnosis now falls in this ICD-10 procedure manual, or these codes, I should say, excuse me. So with that, the ICD-10 codes are vitally important because they are the diagnostic codes. Let's say your client has gastrointestinal dysfunction. There's a diagnostic code for that. Would that code necessarily alert the insurance carrier to the client needs an exercise program? No. Now, maybe if they're obese with a gastrointestinal problem, yes. But just simply a gastrointestinal GI problem does not warrant utilizing exercise. So your ICD-10 codes have to line up with the exercise coding that you're using to bill for the services. So every condition known to mankind, every disease process has a ICD-10 code. So you'll notice we've given you a few here that are in the musculoskeletal arena. M17.9, osteoarthritis of the knee. M16.9, osteoarthritis of the hip. We have a spondylosis here without myelopathy or radiculopathy in the cervical spine, M47.812. A intervertebral disc displacement in the lumbar spine, M51.26. Low back pain, M54.5, and fibromyalgia, M79.7. Now, there are hundreds, thousands of ICD-10 codes. We're just introducing a few to you here for the musculoskeletal region. We have neurologic conditions also that have codes. So G20, Parkinson's disease. G35, multiple sclerosis. G81.90, hemiplegia, which is usually from a stroke or a neurologic condition with weakness or paralysis on one side of the body. Every condition or every diagnosis has a code. You have to know the code because you're going to need to put that on the billing form when you send it in, as well as the CPT codes. So you can see, folks, just the CPT codes aren't enough. You have to have a diagnostic code. And you know who you get that diagnostic code from? From the physician or his or her office. We got some more codes here for cardiovascular metabolic conditions. Essential hypertension, high blood pressure, I-10. Diabetes type 2 without complications, high blood sugar, E11.9, and obesity, E66.9. ICD-10 codes, again, for cardiovascular or metabolic disorders. And then we have a couple other codes that I thought we might throw in. So let's say you're dealing with a client that has a problem with falling or mobility impairments. For a history of falling, you would use the code Z91.81. Okay, this indicates a history of falls. Abnormalities with gait or mobility are 26.89. Post-surgical conditions. Now, if the client has had a surgery and they're recovering from surgery, one of the codes you'll use will be Z98.89. If you're looking at aftercare following a total joint replacement, Z47.1. And let's say the client has a total knee replacement, a right total knee replacement, Z96.651. So these codes depict all aspects of medical diagnostics. And with that, we even have codes that will determine if it's on the right side or the left side. So make sure when you're getting a new client coming in and you're seeking to deal with their insurance carrier, make sure you contact the physician, get a written referral from the physician, as well as have the physician's office or the physician, him or herself, provide you with the diagnostic codes or ICD-10 codes. Make sure you get a primary diagnostic code as well as a secondary diagnostic code. All right. Now, last point here. The codes must align. The ICD-10 and CPT codes, they have to align. Again, you can have a code for gastrointestinal issues, but you're now billing for exercise. They don't add up. But the obesity code certainly would be one that would warrant exercise. So the ICD-10 should support the CPT code provided. The CPT code should be indicated for the ICD-10 code. And the malalignment of the codes results in an insurance claim rejection because they don't fit together. Why am I paying for exercise? I'm the insurance carrier saying this now. Why should I pay for exercise when the guy has a sinus infection? Doesn't make any sense. Make sure the written referral that you're getting from the physician supports the CPT codes that you're using that go along with the diagnosis, the ICD-10 code. That becomes vitally important. So with that, you start to realize these CPT codes are just the procedure codes. Again, we talked about the three main codes that you're going to use for billing your medical exercise training services. Those are 97530, 97110, and 97112. Those are the primary ones. Now, make sure with this, you have a written referral from the physician, and that written referral is for the client you're working with. It's not your patient. You're not providing treatment or therapy. And if that referral says anything about therapy, that referral must be filled by a licensed therapist in your state or your province. So we need to be very clear on those things and make sure you stay within your scope of practice. Your scope of practice is the utilization of exercise to improve the residual functional deficits left over after the client has sustained an injury, undergone surgery, or has a chronic medical condition. These residual deficits are limiting the client's capability with their activities of daily living. Exercise now becomes an important point in helping them, and you can bill for that as long as you have a written referral from the physician. Again, remember, medical exercise training is not designed to circumvent physical therapy, occupational therapy, or other medical services. It's to augment those after the individual has been discharged. So with that, if you want to learn how to set your practice up to accept insurance reimbursement, we offer our reimbursement jumpstart coaching. We're taking $100 off the basic package. And if you go over to crackingthecode.net, you'll see our package there. We have two packages. We have a pro package and our basic level package. This is for our basic level package, and we're offering $100 off this package until Monday. Folks, this is invaluable in helping you to provide the services to the client, but also getting the systems in place that you need, the paperwork, the documentation, the flow in place so you can now deal with the insurance carrier. This is not just simply you just send them a bill. You're going to have to provide documentation of what you did. You're going to have to get the referral, the written referral from the physician. You're going to have to set that up in the system and then actually bill it either electronically or utilizing a written form. And that written form is the CMS 1500. So we go over this in our coaching program. Along with that, you can still also get our Cracking the Code digital manual. Again, it's 398 pages. We recently released this, and it's the step-by-step processes you need to actually deal with an insurance carrier, build the insurance company, but also the infrastructure that you need in place to deal with the insurance carrier, to communicate with the doctor, therapist, chiropractor, and to document and then submit all the necessary documentation. All right. So with that, that's our webinar for today. My goal was to make sure we did this in 30 minutes or less. And actually, folks, I think we've come in at 22 minutes at this point. Thank you again. We're going to wish you also a good Friday and happy Easter. It's Easter weekend, so we wish you well with that. And if you do have any questions, you can email me at drmike@postrehab.com.